Well, thank you all for coming here today. It's really inspiring to see such a great turnout related to our Save My Heart initiative. And Coach Garland, hard act to follow. I mean, we are just so thankful for you coming and sharing your story and sharing your vision and your inspiration. And truly, you coming and telling that story is really an inspiration to everybody who does this work every day. And we really want to thank you for that. And looking forward to partnering with you moving forward to make a difference. As Jim said, I'm Bob Neumar, Chair of Emergency Medicine here at the University of Michigan, and we've been part of a bigger consortium across the state to try to improve cardiac arrest outcomes statewide through this Save My Heart initiative, which we began about 8 years ago. And fundamental to that is the idea of measurement of both our processes and our outcomes. And when we decided to embark on this initiative, one of the fundamental things was to reach out to the National CARES Registry and be able to establish a statewide registry for our out-of-hospital cardiac arrest processes and outcomes, so we could know where we are and know whether the interventions that we do are making a difference in important measurements such as survival and outcomes. So what we've done on an annual basis when we have this meeting is share the annual data, which gets collated sometime in the spring, thanks to Terry's hard work, and we're able to actually show our data for the state as well as compare that to national benchmarks and see how we compare to the rest of the country. So I'm going to go through some of that data now and talk about not only where we progressed and how we compare to the nation, but also highlight some important variability across the state, which really highlights some opportunities where we can have significant improvement. So those are just my disclosures. And just remind everybody, when we think about the system of care for out-of-hospital cardiac arrest, this is the latest American Heart Association sort of chain of survival, which really focuses heavily on the early interventions, including activating the emergency response system, high-quality CPR and defibrillation, which again is bystander initiated, first responder initiation, and EMS all play a role in that, as well as 911 dispatch. And then advanced resuscitation, both by EMS providers as well as in the hospital and post-cardiac arrest care. They've even added sort of a recovery chain in terms of caring for the patients that survive cardiac arrest or discharged from the hospital, making sure they can have a full recovery and return to their lives. So, part of that, as I mentioned, is bystander response, 911 dispatch, EMS, hospital-based care, and then post-hospital care. So what we've done here in the state of Michigan is engage the National CARES Registry, which is a national volunteer registry that looks at cardiac arrest outcomes. And the program here in the state of Michigan is led by Carrie Shields, our state coordinator. And just some of the data on what we've been able to do with statewide is we have 141 EMS agencies in the state contributing data, and then 118 hospitals contributing that outcome data after the patients get admitted to the hospital and we find out what the outcomes of those patients were. If you look at the population of the state of Michigan, we're about 10 million, and the CARES population covered is about 8.8 million. So we have about 88% of the population of the state covered in the CARES registry, which is pretty dramatic. States across the country, is anyone doing any better in terms of coverage of the state?
There's some states that have total coverage, but they don't have the same population.
Yeah.
But there's 18 states that have 50% or more coverage.
Yeah. So I mean, obviously there's some areas where we still don't have EMS providers giving us data, and I think we're going to continue to try to get total coverage, but it's a pretty good representative sample of what's happening in the state. And in 2022, there were 9,275 treated out-of-hospital cardiac arrests in the state of Michigan. And that comes out to an incidence of about 105 per 100,000, or you look at about 1 in 1,000. So for every 1,000 population in the state of Michigan, one person is going to have a cardiac arrest. So that gives you an idea of how the incidence of this in terms of treatment. So how are we doing with our interventions and our outcomes? So the first data I'll show you is our bystander CPR rate. So in 2022, our bystander CPR rate was at 40%. And all of these graphs, the vertical axis is the percentage there, and the horizontal axis is the years. Michigan is in red, the national data is in black. So you can see back when we started this back in 2014, we were below the national average in bystander CPR rate. We had significant growth up until COVID-19. You can see our peak there was in 2019, where we exceeded the national average. And then we, along with everyone else across the country, we sort of dropped down a little bit after COVID-19, but we're holding steady right around 40% near the national average, which is good, but we can certainly do better. And importantly, there's huge variability across the state in terms of bystander CPR rates. So these are individual bars here, are individual EMS agencies that report data from their system. Again, you have to have treated at least 50 cardiac arrests a year to be included in this data. So outliers that only have a small number of cardiac arrests aren't included in this. But to me, this is pretty surprising that depending on where you are in the state of Michigan, your chance of getting bystander CPR is anywhere from 7% to 66%. Okay, so when we think about improving the overall bystander CPR rate of 40%, there's many places across the state that are doing well above that. That dotted line is sort of where, well, it should be moved up. It should be at the 40% mark. But I mean, there's a lot of places where the room for improvement may be in these areas where we have a really low bystander CPR rate, and somehow targeting our efforts to parts of the state where that bystander CPR rate is much lower might give us a better impact on the work we're doing in terms of training people to do it and figuring out that. If we look at bystander AED application, actually we generally do better than the national average. So if you look at the national average, it's at about 6%, and we're at about almost at 9.8%. So this is when an AED is applied, then the percentage of time that the bystander is applying the AED. So we do a pretty good job with bystander AED application. We continue to grow. We were down at 6% back in 2014, and up to almost 10% now is really good. So that's a success story for us for sure. If you look at rate of return of spontaneous circulation, so this is the percent of patients that get treated for an out-of-hospital cardiac arrest that get a pulse back long enough to get transported to the hospital and have a measurable blood pressure. So as you can see here, we started back in 2014 at 26%. We're about almost 28% now. You can see we had a gradual growth up to the pandemic and then dropped down, but we have pretty good recovery over the past 2 years. And for the past 2 years, we are above the national average in terms of our return of spontaneous circulation rate. So again, I think I would consider that a success story for the state. We certainly have higher aspirations to get higher return of spontaneous circulation rate, but I think that's really a testament to the work of the EMS system in caring for our patients. That said, there's again is significant variability. So you can see here individual EMS agencies with more than 50 non-traumatic cardiac arrests treated in 2022. We have there's a nice plateau here right around the average, but there are outliers with really high return of spontaneous circulation rates up to 51%, and some agencies with significantly lower return of spontaneous circulation rates. So again, when we think about quality improvement, learning from agencies that have very high rates, and then looking at ways to focus efforts on agencies with lower RSC rates may be a strategy that we could do to improve the overall rates. If we look at our survival rate, so this is survival to hospital discharge. So of the patients treated by EMS systems, what percent of them actually not only get survived to admission, but survive to hospital discharge? In 2022, we were at 8.1%. This is not a little bit higher than when we started in 2014 at 7.9%. You can see both nationally and in Michigan in 2019 with the pandemic, we had lost a tremendous amount of ground in terms of that. And encouragingly, over the past 2 years, we've had a steady recovery of that survival rate, which is good to see. As of anything, along with Coach Garland, we don't want to be below the national average, right? We want to be number one. So we want to continue to improve that with goals of getting that well above 10%. Similarly, I continue to highlight this variability because think the variability is an opportunity. It both demonstrates that there are systems that are having tremendous success, as high as 18% survival rates, and then systems that are having a little bit more challenge in terms of getting a significant number of survivors. And again, the way I look at it is that the higher survival rates demonstrate that it's feasible, right? It's feasible to have survival rates in the teens for out-of-hospital cardiac arrest. And then, I think there are opportunities to look at focusing our efforts in areas where they might have the greatest impact. Similar to survival, we have also a category of survival with good neurologic function, which is basically not only do you survive to hospital discharge, but you actually can basically function, go back to work, take care of yourself. And really, that's the ultimate outcome we want in our cardiac arrest cases. And that's a little bit lower than the 8.1%. It's 6.6% for Michigan, still a little bit below the national average. But again, we see that similar improvement over the past 2 years. And we continue to be above our starting point back in 2014. But obviously, our goals are to get much higher than that. And then this is another way to look at the data is hospital mortality. So once someone survives their out-of-hospital cardiac arrest long enough to get admitted to the hospital, what is the mortality after that point when they're in the hospital? And we do have a slightly higher hospital mortality in the state of Michigan than the national average at 67% there versus 66% nationwide. And we've been continually higher throughout our time with the Save My Heart program. So that's another opportunity to look at our hospital-based care, once the patient is admitted to the hospital, and figuring out ways to optimize those outcomes. And you see that similar, actually even more amplified variability in terms of hospital mortality. Again, these are hospitals that cared for at least 5 patients admitted after out-of-hospital cardiac arrest. And you see, you can't get a larger range than that, right? 0 to 100% hospital mortality. Now, there's a significant plateau in there, but it just demonstrates that it's not just the care that happens in the EMS system that impacts the outcome, but it's the care that's delivered in the hospital as well, in terms of that survival team is all the way through to hospital discharge in the ICU and beyond. So again, another opportunity where looking at our hospital-based care and trying to optimize that in ways that we can get better outcomes. Some of the interventions that happen in the hospital, we have data on. So going to the cath lab, this is presuming that someone with an out-of-hospital cardiac arrest might have an acute coronary occlusion or myocardial infarction. What percent of those patients are going to the coronary cath lab to have that blockage evaluated and potentially opened? Again, significant variability with actually a relatively small proportion of patients going, and a range of 0 to 23%. And then one of the interventions that has been somewhat controversial, but there's evidence that it improves outcomes in certain patient populations, is cooling or therapeutic hypothermia. And you can see again significant variability across hospitals in the state of Michigan. People are treated with therapeutic hypothermia. So just to summarize where we are, another way to look at this is sort of the survival curve. So if you can look at here again, in red is Michigan and in black is national. If you look at the return of spontaneous circulation rate, we do a little bit better than the national average, but you can see we sort of fall below that national average when we get to survival to discharge and survival with a good neurologic outcome. And I think the explanation for that is we have a little bit of a higher in-hospital mortality than the rest of the country, and it's an area where we certainly need to look at and potentially improve, in addition to our overall improvement strategy. So that's the data. I think the good news is that we are seeing a rebound from some of the loss from the COVID pandemic, and seeing some continuous improvements. I think our goals are much higher for all of these parameters in terms of bystander CPR rates, fibrillation application by bystanders, improving our RSC and survival rates as well. And this is just a really good mechanism to look at that on a year-to-year basis. And that's the data. It's a little bit dry. I think the most important thing is to emphasize that you are all saving lives. So in 2022, forget the statistics and percentages, right? 613 survivors with good neurologic outcome in 2022. Just think about that. 613 people are alive and back to their function that would not be if it weren't for the work that you all are doing. And so that's almost 2 every day, right? 2 people a day are saved that would not otherwise be alive. And these are some of our survivors right here. So we have Coach Garland here, Matt Wood, who's over here with us today as well. And in this picture is Jerry Parrish, one of our survivors as well. So as Jim, mentioned in the beginning, as Coach told us, this was really about saving people's lives and saving people's lives that would otherwise, without these efforts and without this work, would not be alive for their families, for their grandchildren, and for the community. And I continue to go back to this variability that there is real opportunity. This shows that it's possible to have an 18% survival rate from out-of-hospital cardiac arrest. But also shows that in some of our systems we have a long way to go to improve. And I think this variability is a good demonstration of the opportunity for improvement, demonstrating that it's possible to do much better than we're doing now. And when you think about that, right, if you think about whether it's the hospital you go to or where you live, it shouldn't be the case where your chances of surviving an out-of-hospital cardiac arrest depends on where you have it, right? This has been sort of even, I work for the International Liaison Committee on Resuscitation, and part of the theme there is your chances of surviving a cardiac arrest shouldn't depend on where in the world it happens. It also shouldn't depend on where in Michigan it happens. And I think this is, we think about the idea of it's a lottery, right? Your chances shouldn't be tenfold different, 2% versus 20%, depending on where it happens, where on the side of the road it happens, or what city you're in, or what town you're in. So, part of the work we're trying to do here really is to improve outcomes. And part of the work we're going to do the rest of the day is hear about what people have done locally to improve outcomes and improve their system, and brainstorm and think about what we can do moving forward.